Hello, everybody. Welcome to Fertility Fact or Fiction. I am your host, Dr.Victory, and next to me is Tarek Ibrahim from Ibrahim Strategies Group, my very dear friend and all things social media guy. So this is the Christmas edition. So happy holidays to everybody. We do not have a great topic tonight because there were no great articles to present. So we are super excited to have you all join. Thank you to the 1.2 million people that watched our TikTok video. That was huge. And ironically, we have far less viewers on all the other videos, but we're working on it. And to the 1,037,000 views of YouTube, huge. And to all of you that follow us on all the other social media platforms, greatly appreciated. We love you all. Thank you for being part of our community and for asking your questions and for bringing help to those who need it. So absolutely awesome. I see tons of people joining us on our TikTok channel, and I'm assuming you're seeing them on everything else there. Mm-hmm. So tonight we're gonna take questions live. Anything you guys have to ask, feel free. Just so you know the schedule, I am taking a couple of weeks off to go skiing, so I will be away. And so we will not be doing Fertility Fact or Fiction over the holidays. But I guess if tons of people demand it, we can maybe pull something together for a quickie at some point over the holidays. If you guys are getting sick of turkey and family dinners or whatever, you need a break or have some pressing fertility questions, don't hesitate to let us know. We did just release kind of a favorite video of mine, which was sort of the mean tweets version of Fertility Fact or Fiction, where we read the questions from people that had protocols in them that made absolutely no sense from their doctor. So that's up on YouTube, and I think we put a little segment of it on Instagram. Yeah. About 30 seconds. So check it out on our YouTube channel. That one was quite entertaining to do. So lots of love to everybody. Again, happy holidays and a happy new year to everyone. And I think we've already got some questions.
Yep. So we have some questions that came up right away.
Okay.
So we'll give those a little bit of preference because,
they were ready.
They were ready.
All right.
They were ready punctually at 8 o'clock.
Okay.
Hello to my favorite dynamic duo.
Oh, there you go.
How would estrogen dominance affect an IVF cycle? And is there anything I should be cautious about?
So actually, I'm not a believer in that whole estrogen dominance, progesterone dominance thing. That's something that came out of the naturopathy world. I don't actually believe that it exists. There's no proof that you're estrogen dominant or progesterone dominant. If you have high endogenous levels of estrogen, you're probably going to be someone where weight is a factor for you, as in a higher than normal body mass index, or someone who has polycystic ovarian syndrome. In those scenarios, depending on which one is the problem, yes, it does need to be addressed. But aside from that, there's no such real thing as estrogen dominance. So it's not a thing, and there's certainly no fertility management strategy that is based on you being estrogen dominant or not. If you're PCOS, yes, there are protocols designed, specifically to that group. If you have obesity as an issue, then that requires being addressed as well. But there aren't estrogen dominant protocols.
Happy holidays, Dr. V&T.
Yes, thank you.
Fertility results came back.
Okay, cool.
Positive for BV and no lactobacillus.
Yeah.
Is this difficult to treat?
No. So the lactobacillus is easy. You just need to take a good probiotic. They're all full of lactobacillus. And that's a huge factor in your success rate. So I'm glad you did the test because that tells us right off the bat that your good bacteria, which you need, was not there. Especially if it said no lactobacillus, that's really bad. And the one thing that is common throughout every single study is that if your lactobacillus levels are low, it's very difficult to conceive. So very well done. I'm glad you did the test. That's awesome. You need to replenish your lactobacillus. Getting rid of the BV bacteria requires Flagyl or clindamycin. Those are the two options. We use Flagyl as the first line agent, and then Clinda if people are sensitive to the Flagyl or they're having a reaction or it doesn't work. Having said that, the duration of time that you need to use it for varies depending on who you ask. So one of my colleagues uses it for 10 days Fertility themselves, I think, recommends 2 weeks. I use it for a month. I don't think it's easy to get rid of bacteria from the uterus, so we use it for a long time. So can you get rid of it? Yes, we do it all the time. Does it work on first try every time? No, it does not work on first try every time.
Hello, Dr. V, and amazing tea.
Okay.
Just take it. Take it in. Take it in.
Yeah.
Can you explain duo-stim and how it works?
Sure.
Who are the best candidates for duo-stim?
So duostim is basically where you do your normal IVF cycle, follicular. So right after the start of your period, you start your medications, you wait whatever number of days. When your eggs are ready, you do your triggering, you do your retrieval, and then you wait 5 days after the retrieval, you bring the patient back, and if there's enough eggs, you immediately start another stim and then get another batch of eggs. Who is it good for? Women with weak ovaries. It's really good for those. And it can also be good for patients where they didn't do well in their follicular, because sometimes the luteal phase eggs are actually better. So that's a reasonable approach as well.
On TikTok, you got a question. What is your opinion about using creone? I'm also taking this in addition to progesterone and oil.
Yeah, so crinone is actually my favorite progesterone. I love crinone. I do think it gives you the best results. So for the vaginal progesterones, you can either get custom compounded, crinone, permethrin, or endometrin. Those are the ones I'm aware of. I like crinone the best. It's a great product. Yeah.
So people are commenting that they watched the tweets yesterday,
Oh, yeah?
and they said it was hilarious.
Oh, good. Well,
enjoyed
so
it.
we'll have to do more mean
like
tweets.
it.
That's
Yeah,
good.
they
Yeah.
like it.
Very cool.
Hey, Dr. V&T, is melatonin safe in the first trimester? Thank you.
Yes, melatonin's safe the whole time. Don't hesitate.
When does your clinic close? Are any of the nurses have access to their emails over the break? Thanks so much. Merry Christmas and Happy New Year's to the best doctor out there and to T.
Oh,
Thank you.
that's nice. So we're closed as of the 23rd. That's our day that we're done. So the 22nd is our last day, Thursday. And then as far as access to emails, everybody will have access to their emails. But if it's urgent, make sure you call and leave a message, or message your nurse, and there will be someone checking.
So you have a question on TikTok. What are some supplements or foods to battle the side effects of taking Xanax?
Wow. I got no idea what supplements or foods would battle the side effects of Xanax. So I'm a fertility specialist. Xanax is a benzodiazepine. So it's a relaxing agent like Ativan or Valium. I got no idea what would help counteract that. And I'm not sure why you would want to counteract it, because the main side effect of Xanax is relaxing you. And if you need to be relaxed, you'd be taking it. There aren't a whole lot of other side effects from it. So I would take that up with someone that's an expert in, relaxation agents. So like a psychiatrist or maybe your family doctor. I almost never prescribe benzodiazepines. We only use it in very severe cases of stress and for a very brief period of time. They are highly addictive.
What dose of resveratrol and curcumin do you recommend?
So resveratrol, we use about 1,500. Curcumin, we use 60 milligrams. Easy. Thank you for the easy questions. I like the easy questions.
On TikTok, I'm 8 weeks pregnant, and doctor flagged that my fibroids might cause issues during pregnancy. Can you explain how?
Yeah, so fibroids follow the 1/3, 1/3, 1/3 rule. 1/3 get smaller, 1/3 get larger, 1/3 stay the same. If they get smaller, sometimes they get smaller because they die on the inside from a lack of blood flow. And if that happens, they're extremely painful. It can be brutally painful. Enough that some patients actually need to be hospitalized and receive narcotics in order to control the pain. If they get bigger, they can also cause pressure or pain. And if they get big enough, they can interfere with delivery. So you can get babies' heads that don't move if the fibroid is huge. Obviously, the ones that stay the same really generally don't do anything unless they started in a really bad place or are huge to begin with.
Hi, Dr. V&T. Hearts.
Love the hearts, love the likes, lots of likes, yeah.
Do collapsed embryos have a lower implantation and live birth rate?
Yeah.
And what causes a collapsed embryo?
So nobody really knows what causes them to collapse. But yes, there's a study we reviewed a long time ago. Well, I shouldn't say a long time ago. It's probably 3 or 4 months ago that showed that the diameter of the embryo is directly related to the implantation potential. So the more expanded it is, the higher the chance that the embryo will implant. So collapsed embryos by nature have a much narrower profile, and so they have a lower chance of implantation. What causes it? Nobody knows. I mean, we do get it every once in a while. It's not common for us, but we do see some that collapse. It doesn't mean it won't work, but it does decrease the chances for sure.
I've been bleeding nonstop for over 22 days after a chemical pregnancy.
Ooh.
Took Provers for 10 days, period started after, and I'm 9 days in. It's super, super heavy again with no end in sight.
Well, I'd get your beta rechecked, and you also need to make sure you don't have an ectopic. So make sure you get appropriate evaluation by a physician. That needs to be looked at, so I would recommend you get evaluated for sure.
Can you walk me through the IUI process? Would you recommend using meds, Clomid, and Lupron for better chances of success?
Meds, Clomid and Lupron are meds, but sure. Yes, so there are there's 4 different approaches to IUI. So number 1 is your natural egg production. You don't need to take medication. You wait till your egg is ready. You can trigger or not trigger. It's a big debate. And then you go ahead and you do your IUI when the egg is releasing either naturally or stimulated. Number 2, you can take oral medication. So typically that's Clomid or Letrozole. And so you take the medications. Again, you can trigger or naturally surge, and then you're doing your IUI. Number 3 is you can take the Clomid or Letrozole plus some degree of injection. So we did a study or a review of a study recently that showed that for PCOS patients, 3 days of Menopur in addition to Letrozole had a huge increase in the live birth rate from the IUI, so that doubled the chances of success. And then Menopur, of course, went off the market, so we've been holding off on that right now, but we will go back to doing it shortly. And then your final option is to just use injections. So you could just use injections and not use any of the oral meds. So regardless, you start with your period. You take your medications often starting on day 3. So if it's the oral meds, it's day 3 to 7. Clomid, you can also do 5 to 9, but we still use it 3 to 7. You get monitored for the growth of your follicles with ultrasound, and some people will also add in blood work. And in our practice, once you hit an 18, 19 millimeter follicle, we will trigger the release of the follicle. If you have more than 3 follicles that are 18 or 19 millimeters, we actually insist on draining the other ones and making sure that we've retrieved the eggs so that you're not going to end up with a high chance of having multiples, and especially high order multiples like triplets and quads. If you're doing injectables alone, you do the same kind of process. You start on day 2 or day 3 of your menstrual cycle. You need more close monitoring, and when you get to the size of about 13, 14, some people would argue 12, you need to put the patient on a medication that prevents the egg from releasing prematurely so that you're not ending up with 12 millimeter, 13 millimeter follicles releasing prior to the time that they're fully matured. So in that situation, you need an agent like orgalutran or cetrotide that prevents the egg from releasing. You use that in addition to the stimulation meds for a couple of days. Once you get to the point where the eggs are, again, 18, 19 millimeters, you trigger the release of the eggs and you do your insemination anywhere from 24 to 36 hours later.
Hey doc, how tough is the human skull?
Wow, we're getting some weird comments tonight. Yeah, so the human skull is very tough. It can take quite a knock. The problem is that your brain inside your skull has no mechanism by which it's affixed to any part of your skull, and it's sitting in a cushion of fluid. But if you get into a bad injury what happens is your brain swings away from like there's an impact, and then it swings back, and because it's in a confined space, it can kind of pinball between the two sides of your head or skull, and so you can do a lot of brain damage from a bad injury. It's called a coup contra coup impact, or injury. So you can kind of hit the front of the brain. So you're in a car accident, you hit the brakes, your brain slams against the front of your skull, and then it bounces back and hits the back of your skull. So you're injuring both ends of your brain. The skull itself is pretty tough, but I certainly don't want you trying anything. So please, if you're doing something dangerous, wear a helmet at all times. I ski with a helmet and I'm an expert skier. I never go skiing without a helmet. Snowboarding the same. If you're planning to bash someone's head in, please don't. So, God, I hope my wife wasn't asking that question. You're going to warn me if it's one of my kids or my wife.
You can go home safe.
All right. Hope it's not one of the patients either.
Hey, Dr. V, and wonderful tea. I just got COVID and had to cancel my FET.
Oh.
How long do you think I should wait to do the FET?
2 months. Yeah, your immune system will calm down after 2 months. So we tell our patients 2 months.
Nice TikTok question. When you became a doctor, did you always want to practice in fertility? Why fertility specialties?
Okay, so I love laparoscopic surgery. I'm a pretty advanced minimally invasive surgeon. So in Canada, you cannot make a living doing just minimally invasive surgery. And I knew the types of patients I wanted to see would be fertility patients because they have the endo and the fibroids and the polyps and all the stuff we like to do through minimally invasive surgery. So I said to myself, this will be great. I'll get to help people in fertility. I like the fertility stuff, and I'd get to see all the patients I wanted for the surgery. But now I'm mostly doing fertility. I still do all my own surgeries, but we're so busy with the fertility and the things that the surgery has become less of an issue for us. It's also really difficult in Canada to get OR time. So I do about 1 day every 2 weeks right now, or 3 weeks in the OR. It used to be 1 day a week, but the rest of the time is just pure fertility. And I do work 7 days a week. So there's no days off. I'm in here doing consults every Saturday and Sunday as well. So it's kind of 1 day every couple of weeks doing surgery, and the rest of the time is here helping you guys. Once in a while with tea to make videos.
There we go.
Yeah.
Hey, Dr. V&T, my insurance doesn't cover quinone, and I only have enough to get 12 weeks with what I have. Can I switch to Prometrium once I run out?
Yeah. There's no difference in, switching. That's fine. For patients that don't have coverage, go ahead and use whatever's cheaper for you. That's not a problem.
What are the effects of marijuana on eggs and sperm?
So marijuana is terrible for your eggs. It significantly decreases the quality of the eggs. On sperm, it's a disaster. So it alters motility, morphology, drastic increase in DNA fragmentation, 250% increase in miscarriage risk. And then once you're pregnant, it has very significant impact on fetal development, neurological development, personality in the fetus. Once it's born, there are huge, huge issues. We do have a good marijuana video on YouTube. Maybe you can pop the link up. Can you pop the link up? I think the marijuana one you could probably search. So yeah, check that out, and we will definitely encourage you to watch that. It's we probably need to restructure that one. I found the original video I did, because when it came up, I think we did it on like Instagram.
Yeah.
It doesn't look as good as it could. We need to actually just do it like a YouTube video. Yeah. We could, that would be a quick and easy one we could pop back up there. Yeah. We'll put that back up for you, but it's a huge impact on your fertility, male and female.
We'll go from some of the ones that were asked previously.
Okay.
I have to send the confirmation code. Bear with me here. I'll read a question at the same time. Is it possible to have a baby even with pretty severe endo?
Yeah.
It's on the bladder, uterus, etc. My 25-year-old daughter had surgery and was on Lupron, but would like to get pregnant, praying she can.
Yeah, there's lots of hope for patients that have endo. It's not necessarily the easiest thing to do, but it is very possible. So never fear if you have endo. or your daughter in this case has endo, there are lots of opportunities to make it work. There are times where you need more therapy. So whether it's more Lupron or letrozole and Lupron or IVF or whatever the case is, there are many people where we have to help them. But with proper assistance, it's often very possible to help people out.
Gold standard treatment for our high NKC cytokines, IVIG, done all treatments.
So NK would be IVIG or subcutaneous IG, intralipids, prednisone. Viagra can help, actually. Vaginal Viagra can settle NK cell activity. So that's a reasonable approach as well. PRP might work. We don't know for sure, but it does help with patients that have immunological things going on if you put it into the uterus. And then on top of that, there are the other treatments for the cytokines, which is tacrolimus or sirolimus. So there's actually quite a lot you can do. The whole immune world, it's kind of never ending. There's a lot of options for you. So I would encourage you to explore those. If you need to talk to us about an immune protocol, by all means, let us know.
What can you be doing 4 to 6 months out from IVF to improve your chances of success?
Healthy diet, lots of exercise, keep your stress levels low, tons of vitamins, vitamin D, coenzyme Q10. If you have diminished ovarian reserve, DHEA would be a reasonable thing to try as well. No smoking, no drinking, no drug use. Those would be the mainstays.
Post-embryo transfer, day 7, bad sign?
Post-embryo transfer, day 7, bad sign? That isn't a sign. Post-embryo transfer, 7 days post-embryo transfer? What? There must be more to that question.
That's it?
There has to be more. She must have asked another part of it earlier.
That's it.
I need more to that question, whoever asked. So I don't know who's asking the questions here, but there must be more to that. So just tell us, whatever the rest of the question is.
If I got a positive pregnancy test before beta, can I come earlier?
If you got a positive pregnancy test before beta, can I come? Oh, that must be the same.
Different.
Really?
Mm-hmm.
Oh, yeah, you can come anytime you want, but we don't encourage people to test early because the kits that are out there are not that accurate. So your urinary testing kit is not that good, especially when you guys are testing early. So you can get false positives. You can also get false negatives. So it just throws people off. Do not test early, guys. I know it's hard, but just don't. Resist the urge, resist the temptation. And even if I test you early, then you just want more testing. And you can get infections from having your blood drawn. We're taking away your blood every time we do it. It doesn't feel great. We don't want to have to do it any more than we absolutely have to.
Are there any side effects of long-term use of melatonin?
Not that I'm aware of. Yeah, I've never seen any.
Faster than I thought. Trying to go with the other one for you. How long is bleeding expected after a DNC?
Anywhere from about 2 to 6 weeks. It depends on how far advanced you were and how large the uterus had gotten. But anywhere from 2 to 6 weeks would be normal. And most women will resume their normal menstrual cycle if they were regular before within about 6 weeks after the DNC.
How long is bleeding after? Oh, I did that. Is it okay to do a fresh transfer with a progesterone level of 167?
No, not even remotely close. No, definitely no. Fresh transfers are almost universally a bad idea. But if your progesterone level is that high, the problem is your progesterone level was probably high too early. And if it was high too early, then you have a 10% chance of success. So we never recommend that.
Silicone breast implants cause high C-reactive protein leading to multiple chemical pregnant PGT embryos? Question mark.
Can silicone breast implants causing high C-reactive protein lead to multiple chemical pregnancies with PGT embryos? That's a great question. So if they're leaking, that's a huge problem. If they're not leaking but your C-reactive protein is up, it means there is an inflammatory process going on in your body, also not great. So I don't know that there's a direct linkage I could address there, but I would theoretically say yes, that could be a problem. Don't rush off to remove your implants because that could have a whole other set of issues associated with it. But I would probably encourage you to see either an RE or a reproductive immunologist so that we could address the inflammatory part of things and see if we can overcome that so you're not getting the chemical pregnancies with euploid embryos. I'd also probably say that I'm not convinced that's the only problem, so I would want a thorough investigation of everything to see if there's some other reason. I wouldn't be jumping to breast implants because obviously there are, I don't know how many, but there must be millions of women worldwide with breast implants, and many of them have gotten pregnant without any trouble. So I don't think that that's stopping you from getting pregnant necessarily just as the only reason.
How much resveratrol and curcumin do you recommend taking for recurrent implantation?
We did that one earlier, yeah. 1,500 of resveratrol and 60 milligrams of curcumin. And it's not for recurrent implantation failure. It's for patients who have endometriosis. Yeah.
After many abdominal surgeries, is ovarian reserve impacted?
Well, abdominal surgeries by themselves do not necessarily impact your ovarian reserve. Ovarian surgery impacts your ovarian reserve, as do cysts. So most of the time, the problem is we're going in to remove a cyst from your ovary. And when you remove the cyst, especially depending on the technique used to remove the cyst, you can weaken the ovary. The problem is the cyst itself also weakens the ovary. So you're kind of damned if you do, damned if you don't. And so I do recommend it when they're getting big or they're endometriomas. Many doctors don't. I still firmly believe that the reason they don't is because there's a financial loss to them. For me in my hands, when I'm doing this surgery, I think we just get better results. So for us, that's what we do.
Hi, Dr. V and T. Thoughts on Vitex? Which patients benefit from its use?
There is some data for Vitex that it may be helpful for patients. I don't know that they've worked it out in terms of which ones benefit versus which ones don't, but it's a reasonable thing to consider.
Hello, Dr. Victory. I use Gonalef and Menopur and Cetrotide for IUI and had 7 follicles total on both sides.
Okay.
I got Overdrol day 12.
Okay.
Today is 6 days after Overdrol shot and went ultrasound for checkup. My follicle is still getting bigger. Before trigger, it was 1.9 centimeters. Now it's 2.4 centimeters or more.
Yeah.
Does that mean I didn't got to ovulate with Overdrol? It looks like I have more follicles now, like 12 to 15-ish.
Oh, wow. No, I mean, you probably could have still ovulated. I would need to see your ultrasound. Frequently, what's left behind is the corpus luteum, which produces progesterone, and they can get larger in order to continue supporting your pregnancy, hopefully. So, no, that's quite common. We don't necessarily get worried about that, and that's a very incremental change. I wouldn't be concerned about that at all. I don't love the fact that you made 15 follicles, though, so they may have overstimulated you a bit, so make sure you don't develop hyperstim.
Hello, both. Thank you for making this show every week. Do supplements help make more mature eggs, as I have lots of immature ones, or should I use HGH for my next retrieval?
Yeah, I'm not aware of any data anywhere that demonstrates that supplements alter your egg maturity. HGH has been shown to alter your egg maturity. It does favor having more mature eggs, but and that's from a meta-analysis we actually did review on the show ages ago, a year or two ago. But there's no supplement data I'm aware of that shows that there's an alteration of egg maturity. So not that I know of.
Have you ever seen a 45-year-old get pregnant naturally?
Yes, I have seen. In fact, I have a 47-year-old that got pregnant naturally. It's challenging. It's difficult. The risks are substantial for miscarriage, but it does happen. I mean, there is a background percentage of people that can.
Ready for this one?
I'm never sure what to say when you ask me that.
Hello, handsome twosome.
Oh, handsome twosome. I love that.
Love it.
I like that. That's very nice.
This is a
Somebody
good-
must have looked you up, man. Because
No way.
you, yeah, yeah. There's only one video where you
I
like
snuck in.
you snuck in.
Yeah. Don't make them look for it. People will look. Can endosurgery be done via a single incision laparoscopy?
Yeah.
I am worried about scarring. Will donor eggs implant better in an endo patient?
Okay, I'm not sure I understood the second part of that, but single site laparoscopic surgery or single port laparoscopic surgery can be done for endo patients. That's not a problem. It depends on how severe the endo is, but it is used. So that's perfectly fine. There's no issue with that. With regards to endo and donor egg, and scarring. So keep in mind, laparoscopic scars are 5 millimeters. So you shouldn't have very bad scarring, especially if they keep it low in your bikini line, which we always do. With regards to donor eggs, sure. I mean, donor eggs are going to be better in someone that has their an endo cleared than someone that doesn't have their endo cleared. Are you asking if donor eggs are better in you than your own eggs are when you have endo? That's only going to be true if you are older. So if I take an age-matched person, they might have a little bit of a better chance if they don't already have endo using their eggs in you, but it's probably fairly similar. But if you're talking, you're 38 and you're looking at a 25-year-old donor, of course the 25-year-old donor eggs are going to do better.
One more thing. What are your thoughts on fertility teas?
Don't believe in any of them. No proof I'm aware of anywhere that they help. Amanda Jackson said hello. Hi, Amanda.
Dr. V.
No one ever just says hello.
It's a fun world out there.
Thumbs up for Amanda. Lots of likes.
What could be the problem with breast implant removal?
Well, that by itself is going to cause inflammation, right? So anytime you have surgery, you're creating inflammation, and then there's going to be scarring, and there's a whole immune cascade involved with refilling the space where the implant was. So for at least some period of time, you're increasing your inflammation, not decreasing it.
Hey, Dr. V&T, are there any concerns with using a sauna within 3 months before an egg retrieval?
A sauna?
Mm.
No, that would be fine. I mean, it depends on how long you're in there. You don't want to overheat your tissue, but no, that'd be fine. Yeah. Thank you, Carly. Carly sent me a
OHSS advice.
OHSS advice. Okay, good, got it.
Clinic is
Avoid
warning
it.
me that it may happen.
What?
They won't go lower dose. How can I mitigate potential misery?
Okay, that's first of all crazy. That's a mean tweet.
Really?
Yeah. Okay, so your clinic is telling you you may get OHSS and it might not be avoidable, so that's just patently incorrect. So if you use a GnRH agonist trigger with or without a very low dose of HCG, you will not develop hyperstim. So if you use no HCG, it's virtually impossible to develop hyperstim. And if you use a little bit of HCG, almost never do you develop hyperstim. How do you mitigate it? Stop taking such a high dose. There's no reason to keep taking a super high dose. And then lots of protein, lots of fluids, non-HCG triggers. So all OHSS, all of it 100% is due to the trigger. So it's the HCG trigger that causes the OHSS. So if you avoid the HCG, you're avoiding the OHSS. You may get some bloating, you may be tender, you may have some discomfort, but you won't get the whole belly full of fluid thing if you avoid the full dose HCG trigger. No clinic that knows what they're doing that I am aware of anywhere would ever tell someone these days that it's unavoidable to get a ovarian hyperstimulation syndrome unless there's something very unique going on. Like we have had patients where, you know, for whatever reason they're allergic to something or you just have to use the HCG trigger. Okay, then I could kind of see it, but like I mean, I can count those on 3 fingers. So I don't think that that's a common occurrence. Yeah, I don't know why your clinic is saying that, but that doesn't make any sense to me. Like 0.
Somebody responded to her and said, when I had OHSS, I drank lots of Gatorade.
Yeah, I mean, once you've got it, Gatorade and high protein diet, but you need to have close monitoring. They're going to need to check you out. You need to go in for ultrasounds. You may need fluid drainage. Like the last time we had someone with true OHSS, she accidentally took the full dose of HCG when she was supposed to take a very low dose of HCG. So aside from that, almost never. And we drained her once and she was fine.
So we opened up Pandora's box with this one.
Okay. Which one? The breast?
This HCG breast thing. Yeah.
Okay. You mean the C-reactive protein?
Yeah.
All right.
What about bleaching hair during stimulation? Is that okay?
No, stay away from that stuff. It goes right into your bloodstream. Your scalp is one of the most absorbent parts of your body. Avoid putting stuff on your scalp. So bleach on your head is going to get into your bloodstream. You don't want chemicals in you when you're doing IVF.
So follow up to the 45-year-old getting pregnant. Did they carry to term? Also, what age does your clinic stop?
We don't have an age limit at our clinic yet, so you're welcome to come on by. And we'll take anybody. And my 47-year-old actually carried the baby to term. So keep in mind, natural 47 is my oldest, but with donor eggs, I mean, we've had all sorts of people, even much older than 47, get pregnant successfully, even with twins. So age is not a factor when you're dealing with donor eggs. Natural, your own eggs, it is very difficult over 43, but it does happen. It's not impossible, it's just challenging.
Hello, Dr. V and T, with a tea kettle and a heart.
Oh, that's cute.
So the tea is now
a kettle.
A kettle. Yeah, you got it. Just so you can visualize it, because you don't have the screen. Any supplements?
I'm going to get you a t-shirt that says T.
Yeah, that's it.
But TEA.
Yeah.
Yeah.
Any supplements or things a woman can do to increase her libido? Hashtag wanna be 20 again.
And she's not trying to get pregnant?
I'm not sure.
Okay, so in a woman who is not trying to conceive, testosterone works really, really well. You just got to be careful with the dosage so you don't start getting male type symptoms. Viagra helps. We have a really good video, which somebody needs to adjust the tab on YouTube, which talks about how to improve your orgasm. So it's all about the effects of Viagra in women. So Viagra in women works really well. It actually increases your libido. And then there is cognitive behavioral therapy things you can do as well. Number one thing that improves it is communication with your partner. So if you tell them what you like, what you don't like, what turns you on, and they do it more often, I mean, that helps more than anything else does. And then it's always good to kind of freshen things up. So whether it's reading a book together, watching a movie together, a more sensual or even, sexually explicit movie, or whether you're going to the adult store or trying something you haven't tried before, all that stuff works. We got a TikTok.
Yep.
I appreciate you, Dr. Victory, your staff, and all your nurses during my difficult time right now. I'm sorry you're having a difficult time, but our hearts go out to you, and any way we can help you, let us know, okay?
Yeah, they say I have to have HCG because I am hypothalamic.
Well, okay. So if you had, this is for the person that is worried about OHSS. So if your LH level at the start of your cycle or even during your cycle was super, super low, then yes, you will need HCG. So we always advocate for double trigger GnRH agonist with HCG, because if your LH is really low, the GnRH agonist trigger by itself won't work. But we get away with doses as low as 500 of HCG. Sometimes we even use 250, and we use the GnRH agonist trigger, and together it works every time. Like, we have not had anyone we couldn't retrieve. So I would recommend they try that. And before you develop full-blown OHSS, tell your clinic doctor to call me. I will happily talk to anybody to avoid OHSS.
Common reasons why a PGTA normal embryo would not survive the thaw during an FET.
Bad lab, not an energy efficient embryo, wasn't actually PGT normal. Bad embryology technique. Those would be the main ones. Bad luck. I mean, sometimes it's just bad luck. The freezing didn't go right, like when it was initially frozen.
I had my favorite duo.
Favorite duo? We were the dynamic duo. Remember Batman and Batman?
Yeah, don't ever forget that. Batman and Batman.
Yeah,
Absolutely.
I'm glad they did that too, because we'd still be arguing about which one was
I would
wrong.
never be Robin. I just wouldn't want to be it. I would just not take it. I'd just be Batman. I'd rather be anybody else.
Yeah.
Be Catwoman for God's
Meow.
Does having the flu accompanied with a fever affect the fetus? Currently on day 5 of fighting the flu while 12 weeks pregnant.
So unfortunately, the fever can impact pregnancy, and it does increase the risk of miscarriage. So take your Tylenol. Don't take any NSAIDs, but take your Tylenol. Keep your body as cool as possible. Lots of fluids, lots of vitamins, that kind of thing. But yes, there is an increase in risk of miscarriage. The flu itself does not negatively impact the pregnancy. It's the side effects of the flu. So the virus doesn't do anything to a pregnancy, but fever can, respiratory distress obviously can, that kind of thing can be risky. Pneumonia, hypooxygenation.
Back to the head, it seems.
Back to the head?
Can a concussion cause a nosebleed?
Where are these questions coming from?
You're just the doctor on call right now, I think.
Oh, hey, SMBC Can is
we
back.
go.
Hey, SMBC. Yeah, can a concussion cause a nosebleed? The concussion can't, but whatever impact caused the concussion could, sure. I mean, your nose, that blood vessels can be hemorrhaged, and if you smacked into something, sure. I mean, I could try it on Tarek to see, but he'd be bleeding.
Batman.
Yeah, Batman. I don't bleed.
That's right.
Did you see that TikTok where the kid goes to class as Batman?
No.
Oh, it's hilarious.
Share some of these videos.
It's really
I
funny.
keep sharing it, like things that are to use. And you're
I
not sharing
know,
the good
I
stuff.
know. He's in a full like Batman costume, and he even does the voice, and the teacher is asking him questions, and he's answering like Batman.
I can see my son's doing that.
It was very funny, and then the teacher is dying of laughter in the class. It was hilarious. Yeah.
How can you properly track your thyroid during an IVF treatment? How often should it be checked to ensure that there isn't a thyroid condition?
So during stim, we would check before, which we always do, and then I wouldn't check again. During FET, I would check before. There are women that are sensitive, especially if you're taking estrogen, which we don't recommend as part of your stimulation. So in those specific circumstances, we would suggest to you that you essentially just monitor once before and then once during your FET protocol at some point in time. You definitely want to do it at some point where there's enough time to adjust and recheck if you have to. But keep in mind, thyroid takes weeks to stabilize, so adjusting it quickly doesn't always allow for the appropriate intervention.
Hi, doctor. I have chronic endometriosis.
Okay.
And I had to take biopsy 3 times as plasma cells kept detected after taking antibiotics.
Yeah.
What do you usually do in this case?
So you're doing the wrong thing. Biopsies are useless. It's been proven to be useless. Do not do biopsies. So what you really want to be doing is you want to be doing fertility, and you want to actually get tested for the DNA of the specific bacteria that are in your uterus so that you can target the antibiotics to the specific bacteria, and then at the same time drown out any bacteria by putting in your good bacteria. So you want to take like a probiotic or something like that to kind of refill the space that the bad bacteria was in, and then it prevents the bad bacteria from getting in. We're actually thinking about starting that here, doing the testing here in-house. I just had a meeting yesterday, so we might have like Fertility Canada, which would be kind of cool.
That's super cool.
It is cool, yeah.
That's super cool.
Yeah, yeah. I don't even need them for that part. I need them for the other part. So, yeah, we were talking to the company that does the testing, and we'll probably buy the setup here for the new year sometime. So,
Oh, super cool.
that would be cool.
That's
yeah,
super cool.
yeah.
Hi, Dr. T. Is there anything you should avoid during those months leading up to an egg retrieval, other than no smoking and alcohol?
Is there anything you should avoid?
Yeah.
Oh, no new sexual contacts, so you don't pick up an STD. No drugs, no smoking, no alcohol. Excesses of sugar, cholesterol. Don't get too stressed. And I wouldn't do anything that's drastically going to change your body. You want your physiology to be pretty stable. SMBC says, I know this can be different between doctors, but SMBC I have no idea what you're referring to. There's no context there, so tell us what you meant. Yeah.
Maybe Batman and Batman.
I don't think she meant that between doctors, dude.
Not all doctors can be Batman.
This is true. Not all doctors can be Batman.
Right.
Yeah, yeah,
That's how we're going to look at it.
yeah.
Dr. VNT, what level of prolactin is potentially concerning in a woman pre-stim cycle, and how does one reduce it? Also, how often are TSH levels monitored during stim cycles?
Okay, so I answered the TSH part just a moment ago. Most labs use a prolactin upper level of 28. If your prolactin is over 28, you then need an additional test called a monomeric prolactin, and it has to be done between 8 and 9 in the morning. And then if your monomeric prolactin is still elevated, then you need treatment. So treatment has to be with medication. There's no natural products to reduce it. SMBC, I cannot go backwards because if you had any idea how
Delicate this is.
podunk our setup is right now for this, do not shut that thing off, man. Okay, so because TikTok in Canada does not allow us to use one platform, and don't go there. We currently have my cell phone taped to the tripod that the camera's on. Just stop messing with it, man.
There's no hope.
Yeah, and now we can't actually see where we were. Oh, well, you know what? Oh no, now it says one new message. You got to go down. Push the one new message button.
Easier said than done, Dr. Victory.
Yeah, this is as MacGyvered a situation as you could ever imagine. There we go. I'm doing IVF in 2023, AMH 22.1. Wow. SMBC, that's awesome. You're going to do great. Make sure you go somewhere really good. Okay.
Reoccurring fluid in lining, what causes it?
We answered that before. Number one would be an isthmocele, the little, steeple defect in the uterus. We actually have a
Video.
Is it a TikTok? It's our TikTok video.
Was that what it was?
I think it was a TikTok video. We have a whole TikTok video on fluid in the uterus.
Yeah.
I can't look at my phone. We have a TikTok video on fluid in the uterus, so check that out. It could be your tubes. It could be infection. It can be bad luck. It could be a really tight cervix also. What would my protocol look like roughly? That's what SMBC is asking.
Better answer it.
Okay, so SMBC Canada, I'm assuming Canada, because it's CAN, has an AMH of 22.1, which is relatively high, and a huge antral follicle count of 33 to 38, which is awesome. I don't know how old you are, but I would use a 50-50 split of, if it's available again, Menopur and Gonal-F. Hopefully it'll be available. I would use that for a maximum of 11 days. Oh, you're 29. Lovely. So we would use that for a maximum of 11 days, maybe 12 if we were really pushing it, but you really shouldn't need that. Starting dose for you, if you're not PCOS, I would probably say 112.5, 112.5, 137.5, 137.5, max 150, 150. Do not go over that. and I'd probably taper you down as you went because you're going to make a lot. Double trigger gonal-F, gonadotropin releasing hormone agonist. So that would be like a Lupron, Decapeptyl, whatever, with a very, very small amount of HCG. And you need to start your Cetrotide or Orgalutran once you have a couple of follicles that are past 12 millimeters. Beyond that, I would need to know more about your history, but that's the basics. So 50-50 urinary to recombinant gonadotropins. Start your antagonist when they're like 12, 13 millimeters, and then do a double trigger, but be really cautious with which one you use. Does low dopamine D2 receptors... We get some wild questions here. Does low dopamine D2 receptors lead to poor memory and cognition? I honestly have no idea. I'm a fertility specialist. I know a little bit about memory, but I have no idea about that one. I am having a C-orn addiction, and I unfortunately relapsed a few moments ago. I'm assuming that's porn, but I'm not really.
Corn, to be honest.
Well, who would have a corn
I
addiction?
think it's a joke. I can't imagine what that is.
I think that's got to be porn, but I don't know. Yeah, this is a wild show. We've never had it.
On over there, it's a wild show. Anyone can just tune in.
There's some weird stuff happening on TikTok. Yes.
There you go.
Excellent. Yeah, I can't tell you anything about your porn addiction relapse. Yeah. Actually, porn addiction is very bad for you. It is actually very seriously damaging to your overall health. So try and avoid porn addictions. We do use porn sometimes therapeutically to help patients. So I'm not going to say it's a horrible thing overall, but a porn addiction is not a good thing. And actually, it's been shown to drastically reduce productivity. I need your help, doctor. I'm not the right guy to help you with your porn addiction. Sorry. That is too funny. It's getting wild on TikTok. TikTok's like a whole other level of wildness. Okay, next question.
My cycle is usually 27, 28 days.
We can't make this stuff up, man.
No, we cannot. No, we cannot. My cycle is usually 27 to 28 days.
Okay.
Last month was 6 days late, negative test.
Okay.
This month already 6 days late, no period, negative test.
Okay.
What could this be from?
Stress, weight change, up or down, diminished ovarian reserve, hormonal fluctuations, abnormal thyroid. You could be getting pregnant and then miscarrying very early. So there's a bunch of different things that could do that. We'll sign up to my...
I think we're done. I don't know if we're supposed to keep reading. I think they can be happy there. That's happy land.
Carly's looking for people. Oh my goodness, Carly, I love you. You're hilarious. Carly, was that Carly that asked about the early FET test?
Yeah,
I thought it was Carly.
Actually. That's great.
Carly, you crazy woman, congratulations. And yeah, for you, I'll make an exception. Come in tomorrow and we'll do your test. Yeah.
Do you recommend people that I can work with for PCOS before I get to work with you? Thank you, Batman and Batman. Sincerely, Catwoman. This is just great.
It's great. I love that. Batman, Cat. You know what? We should we need ourselves a Catwoman.
Absolutely.
That would be kind of cool.
That's cool for sure.
I just don't know who we'd have as the Penguin. Yes, naturopaths are great. Dietitians are going to be helpful if you're struggling with your weight. That would be, really wonderful. So I guess someone in the gym as well, like a trainer, all those would be good. Yeah.
Do you prefer low dose HCG or Manipur for stim when egg quality is a concern?
Manipur. I'm not a fan of low dose HCG. I don't think it works.
Oh, Dr. V and Batman.
Oh, ouch, ouch. Yeah, that's painful.
I actually liked it a lot.
I took one to the gut
But
on
you
that.
still got the
Yeah,
DR.
of course you like it.
You got the DR. You're Bruce Wayne at this moment. This is the Bruce Wayne
Yeah,
universe.
this is more like Dr. Jekyll and Mr.
That's
Hyde.
right. Now we have alter egos.
Yeah,
If it says ANA is negative.
yeah.
outside.
Anti-nuclear antibody.
Oh, okay.
Yeah, ANA. Yeah.
Yeah, that's why you're Dr. V.
Okay, Batman.
Yeah,
keep going.
exactly. Is negative outside of the FET cycle. Is it safe to assume it will stay negative, or can it become positive if FET works? Need to retest.
No, I wouldn't retest. No. I mean, if you're taking a ton of estrogen, you can start some inflammation, but not enough to get a positive anti-nuclear antibody. So I would think you're safe. Oh, Carly is saying she'll wait until beta. She's just kidding. Right. Carly, come in. Now I'm curious. Stinker. Yeah.
Hello, Dr. V and Batman. Different question.
Yeah.
But I obviously.
But you just love this now, so you're just gonna rub it in.
I'm
Yeah.
officially Batman,
Yeah.
and I'm gonna go.
I can just give myself paper cuts and grab you a lemon.
No, not
you just
necessary.
squeeze it right in.
No. I like the title. It's nice. I feel very powerful. I'm telling you.
We just need to get you a Batmobile now.
You know what?
Yeah.
That sounds about right.
That would be cool.
That sounds about right.
Yeah.
Everybody pitch in. There's a lot of people.
All we
watching.
need is a couple million, and
That's
you're
all we
good to
need.
go.
And we
Yeah.
got the Batmobile.
Yeah.
Day 5,
Yeah.
2 BB, and day 7, 4 BB blasts sent for genetic testings. Are
Day
they good?
5, 4 BB. What was it?
No. Day 5, 2 BB.
2 BB.
Day 7, 4 BB.
Day 7, 4 BB. Okay. Yeah.
Blast sent for genetic testing.
Yeah.
Are they good grades at this point?
The 2 is a little small. I don't know why they froze it at a 2. I would have waited till the next day. The 7 is the day 7 is a day 7. So those are not quite as good as the other ones are, but it's reasonable.
My question was skipped. Let's see about this.
Oh,
Do you know any fertility support groups?
that's
you
a
can recommend?
Tariq issue. Just so
Yeah,
you know, I'm innocent because I can't see the questions, only on TikTok, which is a screen right next to me here. Fertility support groups, yeah, we have one, and we have loads of people that can help you. So just contact the office and we will help you. And we also have Organic Conceptions, which is an online program which is free for all of our patients. So we have a very strong program: social worker, family doc, psychologist, online program, and groups. And Dr. Julia Sen, who's amazing, who does it in a group as well. So there's all sorts of people we can help you with. Plus Bria. Yeah, Bria. There's loads of stuff we can do for you. Just call the office. We'll be happy to help you out.
I would appreciate clarification on how this question, if it was asked on a different platform, because I don't see it in the live stream.
Oh, Tariq wants
Work.
clarification because now he's wounded.
Yeah, Batman took a little bullet here. He's not very happy about it.
Yeah, just let us know.
Do you have any for and
Was that English?
that was me rereading very quickly. Yeah. I don't think you were supposed to hear it. I
Okay.
think that was supposed to be in my mind
You
only.
do realize we're live here, right?
There are moments that I may forget.
All right.
And question was a follow-up to a comment you made. What are fresh transfers universally? What are fresh transfers universally bad idea?
Oh, because A, your estrogen levels are high, and B, your progesterone levels are high. So high progesterone level means it won't work. It reduces your chances to less than 10%. And high estrogen levels increases the risk of multiple complications and failure. So IUGR, preeclampsia, growth restriction, small for gestational age, preterm labor, they're all increased in the presence of a high estrogen at the start. Which is a big part of why we also don't use estrogen typically as part of our FET protocol, only if we have to. So fresh transfers are never a great idea. There's actually an article on fertility and sterility comparing fresh versus frozen, and one of the best done studies on this is a big Chinese study which actually showed that frozen has a higher success rate, and we all know it's safer. So it makes perfect sense to be doing frozens.
Ready?
I'm always ready.
Hi.
Hi.
Why is the blood types of both partners tested before starting IVF? Thanks.
No good reason whatsoever at all. Unnecessary completely. You don't even need your blood type to do IVF. It's a different story if you're asking about comprehensive carrier screening. But yeah, aside from that, it's not an issue. Matt just texted me back to what I sent him saying lol. Yeah.
My endometrium thickness is always good during ovulation phase, 8 to 10 millimeters.
Perfect.
But my period is very light and lasts 3 days.
Okay.
The color is also very dark brown after period. My thickness is 5 to 6. Should I be concerned about my light period?
No. Every woman has different periods. It depends on the severity of the spasm of the spiral arteries in your uterus. So, and the degree of prostaglandins that are there. So that's not a concern at all. I'm having serious trouble watching our MacGyvered phone job that we did here.
New year, new stands.
Well, I forgot. I'm totally. I'm to
totally-
blame for that one. Yeah.
Totally your fault.
That was me.
Totally your fault.
I know. I'm sorry.
Okay.
I'm a bad man.
The good news is,
Yeah. We should hopefully have it fixed if you message TikTok.
yeah, that's right.
That
That's
would
what we're
be
hoping
good.
for.
Yeah. Yeah.
AV&T.
Maybe they're watching. TikTok, if you're watching, can you give us the code so we can just do this off of one camera, please? Yeah.
For a FET, is estrogen only used to thicken the uterine lining? I did a
Yes.
mock letrozole cycle, and according to my RE, she saw no difference in my body's response.
Yeah, you only need it to thicken the lining. That's it. Nothing else. And if your response to estrogen was the same with estrogen and letrozole, then 100% do the letrozole because it's been proven to be better and safer. Lower miscarriage rates with letrozole.
Is DFI of 19% too high for IVF? Does it need pretreatment?
It's not too high, but we'd like it lower. A DNA fragmentation index of 19%. You're in the good to fair category. So we would like it to be in the good to great category. So 0 to 15 is in the top category. 15 to 25 is the lower category. 25 to 50 is bad. And then less than 50, or like greater than 50, I should say, it's a disaster.
Does DFI of 19% too high for IVF? Does it need pretreatment?
That was one you just read.
Yeah. What vitamins would you recommend for a couple who's struggling with unexplained infertility for 5 years? No other diagnosis. Laparoscopy, failed IUIs. Thank you.
So unexplained infertility will not respond to vitamins. So I actually wouldn't recommend any vitamins for that. Only vitamin D. But unexplained infertility, there are only 4 things you can do. You should watch our video on unexplained infertility on YouTube. It's a great video. So number 1 is IUI with pills. Number 2 is IUI with injections. Number 3 is IVF. And number 4 is surgery. Nothing else works. They've tried everything. Nothing else works. That's a good question.
Hi, Dr. V. After 3 failed transfers, I had my cervical niche repaired. After first transfer, post-op ended in miscarriage. I have 3 embryos left.
Okay.
I've done so many tests and all normal. My RE says keep going.
Reach out and talk to me and let me see what tests you've done. Because my suspicion is you probably haven't done all the tests you could. So reach out. We're really thorough and we tend to do a lot more testing than anybody else does. So DM me on Instagram and I'll help you out. By the way, I have no idea how to check messages on TikTok. So God, I hope people aren't sending us messages there. I have no clue. That's you, man. I do not know how to do it.
No problem.
Yeah, not a clue. I can barely manage one platform. Yeah. Did we freeze on TikTok?
No, I don't think so.
Because that hasn't changed.
The bottom part always changes. Who joins?
Yeah, but it hasn't changed. It's been the same the whole time.
Ask somebody to give you a heart.
Carly, send us a heart if you're still on TikTok.
Or anyone.
Or anyone. Anyone send us a heart. I don't know. Oh,
There you go.
Nora joined. Okay, I guess so. Yeah. All right. Next.
Okay. Thank you so much. I wish I could start up your clinic tomorrow, but I'm all the way in Markham. Can you recommend any fertility doctors as good as yourself around this area?
Oh, never ask me that because that's not fair. There are lots of good fertility docs. Markham is not an issue. We have lots of people from all over Canada and quite frankly the world coming to us for their fertility care. I just got off the phone before the show with someone in Tennessee that's coming to us. So Markham is really not a problem. We have patients coming to us from Australia. So it's easy. You just get monitored there and then you come to us for your egg retrieval and transfer. I don't want to throw names out on the show because I'll upset all the other doctors out there that I didn't name. But you can reach out to me privately and I'll say it. I want to be careful about what I say publicly on the show.
Seems reasonable.
Very reasonable,
Yeah,
right?
very
Judicious?
reasonable.
Yeah,
Yeah,
very
yeah,
judicious. Yeah.
Is a mock cycle a good thing to do?
If it's free, it is. I think a lot of places charge for your mock cycle, and I find that kind of dumb. I mean, we do your mock cycle as part of your testing, right? So when I'm testing you, I know what your body's doing naturally. So I don't need a mock cycle because I already know where you're going to be, what you're going to be able to do and what you're going to get to before I ever even start treating you. So for me, that makes a lot more sense because our diagnostic testing is free. So, that makes it easy. If I didn't know that, would I want a mock cycle? Not really, as long as, or maybe you could do it, but what I always tell my patients is if it looks good, we're just going to use it because I don't want to charge you to do a mock cycle and then charge you again to get you ready for your FET. Why? Like that just doesn't make sense.
Dr. V&T,
Yeah.
would you recommend that your PCOS patients continue metformin for the whole,
Yes.
throughout the whole pregnancy?
Yes, absolutely. It'll reduce your gestational diabetes risk, and your body doesn't like doing this when you're pregnant, so just keep it nice and stable. Wifey will be coming to pick me up soon because I have no car.
All right.
So we got to wind it down. A few more questions?
Sure.
Okay. Oh, wait. Can I ask for fertilized test? It's Fertiliosis. For my RE, is it common? No, it is not common. And let me save you some money. Although you won't need me, but you kind of need me. So contact Fertiliosis, and it's Fertilys. Tell them you're my patient, and then tell them you want the Victory combo because we made them make their combo test cheaper for our patients. So it has nothing to do with us. I don't get paid for it. I have no financial involvement, but the prices were too high, so I made them reduce it for our patients. So yeah, just contact Fertiliosis on their contact page. Say I'm a patient of Dr. Victory's, even if you're not. And then just say, I want the Victory combos. There's two. There's a really sophisticated one and there's a slightly less sophisticated one, but they're both very advanced. And then just order those tests and they come to you. Yep. And then you'll need a doctor to interpret it. So for that, you would need me or another doctor, but the Fertiliosis folks actually send you a write-up of what you can do in the results. So you don't 100% need to talk to a doctor, but it does get difficult to know what to use for what bacteria and so on.
I think it's really nice of you.
To what?
To give the
Victory combo? Oh,
yeah.
thanks.
I think that's a
Yeah.
real doctor move.
We got to help everybody.
I like it.
Yeah.
I like it.
Yeah.
Um,
I didn't tell you about our Christmas miracle the other day.
you didn't.
No, we had a couple that came in who had lost their jobs and had no insurance. They don't even have OHIP. So, and she's been trying and she's going into menopause. So I offered to do their testing for free. So
No kidding.
she was bawling. And yeah.
Oh, wow.
Yeah, so it was kind of nice.
Look at you.
Good move.
Good move.
Yeah, my daily good deed for the
That'll take a little bit.
Yeah.
That's good.
Yeah. Score some points with the big guy.
I think the big guy liked it.
Cha-ching.
Hey, Dr. V&T, would you recommend that your PCOS patients continue metformin throughout the whole pregnancy?
You just asked
Yeah.
that one. Yeah.
Nuvaris versus Menopur. Which works better? Do they both give the same results?
They don't give the same results, and I do definitely prefer Menopur. I love Luvaris. It's a great product. Love Serono, fantastic company. But Menopur is better in combination with Gonal-F, which is a Serono product, than Luvaris is. Yeah.
How
At least
fast?
in my hands with my protocols.
How fast can we get into you for a second opinion?
Oh, depends on the urgency of your case. Anywhere from a couple of days up to a couple of months if it's not that urgent. We got a lot of people that want to see us
If they
now.
throw the bat sign up, I might be able to.
Yeah, if you're putting up the bat symbol in the sky where Tarek can see it, he'll find you and get you in.
That's right. I'll take
Yeah.
care
Yeah.
of it. Is teratozoosphermia manageable?
Teratozoosphermia? Yeah, it just means that you have abnormal sperm. No smoking, no drinking, no drugs, loads of vitamins, ejaculate frequently, keep your testicles cold. They usually will improve.
Gender suction is illegal in Canada, right?
It is a federal offense. You're going to a hardcore federal penitentiary for doing it. So please don't even ask for it. We got a report from our genetics company, which is not supposed to contain the sex of the embryos on it. And my embryologist said, you know, the sex is here. And I immediately turned away and I said, I don't even want to see it. Just go black it out so that it's impossible to read. I do not want to see that. So yeah, it's like a really bad thing. And we actually had to call the company and say, never, ever, ever, ever do that again. We do not want to know the sex. Only if there's a sex-linked genetic disorder. SMBC can, yes, you can have a second opinion without switching clinics. Although I want to give you full disclosure, almost everybody that has a second opinion with us does switch clinics to us, but you don't have to. What? Go ahead.
Hi, Dream Team.
Yeah.
Do you recommend repeated fertility testing if you had a new partner since the last test?
Oh,
There were no concerns at the first test, planning on use stim cycle.
that's interesting. I've never been asked that before. Depends on how many embryos you have. If you have a lot of embryos, no. But if you don't have a lot of embryos, you want to dot every I and cross every T, not unreasonable. See if Fertility, they're actually a really good company. They might let you just do it as the repeat test, so you wouldn't have to pay the full amount. So ask them. I think we got to wind it down.
Okay,
The princess will
I'm
be
taking my lead from you.
from me. Yeah, the princess will be waiting. Okay, well, thank you all for watching the Christmas edition of Fertility Fact or Fiction. It was a great evening with some very funny laughs and one porn addiction.
That actually was answered.
That was actually quite funny. Anyways, have a great evening. Happy holidays to all of you. If you celebrate, that's wonderful. If you do not celebrate, enjoy the time off, if you get any time off. For all of you out there who have been through a hard year, I hope that the best, the best of this year is the worst of next year for you, so that next year is an amazing year overall. Love you all. Have a great night. We will see you again next year.